Hey, everybody. This is Chris
and Cathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Cathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
%80 of dogs over the age of 8 have the onset of osteoarthritis.
Welcome to Petability. I'm your host, Cathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hello, Cathy.
Hey, Chris. How's it going today?
Good, man. It's been a busy couple weeks because I was thinking about all the stuff we have to catch up on and catch our audience up on.
I know there's so much. It's kind of overwhelming to think about all the stuff we have to do. And I appreciate our listeners' support because I know we've been doing a lot of rerunning old episodes, and I love that people are going back to listen to our rehab rewinds. So I really appreciate people hanging in there. But we're going to have some really good new content this fall coming.
Yeah, absolutely. And I have to congratulate you for your newly acquired certification in palliative care. You now have more initials behind your name. So I know that our listeners that do follow us regularly are privy to the fact that you have been working on this for a really long time, and now you've earned the title.
16 months of this program, classes, quizzes, the paper, my 18-page paper, and the final exam. And so now I do have the credentials CHPT, Certified Hospice and Palliative Care Technician, in addition to CBT and CCRP. I want people to understand that their pet's quality of death is equally as important as their quality of life, and that they should pass with the dignity and the respect and the love that they deserve. Now, does that always happen? Sometimes we have emergencies. It doesn't always happen, but when we can provide that for them, we should.
I just want to give you a little bit more kudos because you were so nervous about your exam. And then I'm like, Cathy, because you had to get a 70% or something. And what
80,
what did you get?
I got 100.
Hey,
I had to get 100 because I knew you were going to be like, you only got a 90.
No. But the cool kids say 100 P.
100 P.
100 P. That means 100% for
that's what I got
out there.
Yeah, I got that. And, thank you. I have to thank the International Association of Animal Hospice and Palliative Care for accepting me into the program. The instructors are wonderful, the doctors, the mentors, and the technicians. Being a hospice and palliative care technician for animals is more than just a profession. It's a calling, a profound commitment to being there for beloved companions when they need us the most. And it's about embracing that raw, beautiful, and sometimes heartbreaking reality of life's final chapter. So thank you. There'll probably be a parade and a ceremony and a sash. So stay tuned.
Well, it's interesting that you talk about, the endings aren't always what we hope for. And I had a little foray in that. I happened to be going by my old neighbor's house. I stopped to say hello. And she says, "There's a baby squirrel in my yard." And when I looked in the bushes, one had already passed. They had moved one a couple days before. I grabbed the third one and I called a wildlife center, and she said, you can bring the baby squirrel to our facility, but it was over an hour away. She said, but I'll send you a link and maybe you can find someplace closer. And lo and behold, I was amazed to discover that there are wildlife rehabbers in almost every community. So what I knew, Cathy, is that bringing this little squirrel to a professional was going to give it its best chance at life. So I did. I brought little Rocky to Tyler's Wildlife Rescue. But ultimately, about 3 days later, Rocky passed.
If you find something like that, a baby squirrel or bunny or bird, you should always reach out to your wildlife rehabilitators. Don't take them in yourselves. Their best shot at survival is with the professionals. And if they're not going to make it, their best chance at a peaceful death is also with your wildlife rehabbers. So if you find wildlife outside and they're injured or in need of medical attention, get them to the wildlife rehabber. They're the experts.
And we also had an episode on wildlife rehabilitation a while back.
Ooh, with Bethany Brown from Saco River. Yeah.
Up in Maine.
That's a good one too.
So let's pivot to the topic at hand. Today we are discussing arthritis in pets. So many dogs and cats and other species have arthritis. And we've been wanting to talk about this for a really long time. Everybody is like, I have arthritis. My pet has arthritis. What's the big deal about arthritis? Well, it is a big deal, right? You said as you were preparing for this podcast, you were getting angry at osteoarthritis.
I was like, what am I so angry about? Because I was like, and this and that and the other thing. And I'm like, you know what? I'm angry with osteoarthritis.
Quality of life.
Right. And it's the prevalence of it in our practices. There's so many patients and pets with osteoarthritis. And I was thinking about it as I was getting mad at osteoarthritis, that there are several factors that in our pets that may lead to diminished range of motion, flexibility, and strength and proprioception. And among our senior dogs, I would say, or seniors, I would say degenerative joint disease or osteoarthritis stands out as a primary culprit behind mobility limitations, and it's chronic and progressive.
And I think, too, what people don't realize is sometimes with a primary diagnosis, maybe when their pet is younger, that leads to arthritic changes down the road.
Right.
And even if they haven't had those issues, those conditions, those traumas, whatever it may be, simply aging leads to degenerative joint disease because it's a wear and tear problem. Exactly. So, we talk about cranial cruciate ligament injuries being like the number one orthopedic injury. Well, the lack of stability in a knee that has torn its cruciate leads to arthritic change. And even after having surgery, the likelihood of having arthritis is still there. We're just hoping to make it not as severe, maybe not onset quite as early. Right. And then you have all those dogs with like elbow and hip dysplasia, right? Mm-hmm. Those congenital conditions that are an incongruency or a laxity. So the term dysplasia just means that there's a problem with the joint, but what causes the pain and dysfunction down the road
is the arthritic changes.
Yeah.
And we had a show not that long ago, Chris, where we talked about like the length of your dog's toenails. And even something simple like that, having long toenails, and then the toenails dig into the ground and it pushes the nail up into the nail bed, and that repetitive friction is likely to cause or likely to be a contributing factor to osteoarthritis in your dog's feet.
Mm-hmm.
So
and it carries up the kinetic chain. Right. From the feet to the wrist, to the elbow, to the shoulders, to the spine.
Right. I don't know if you probably have heard this, but studies have shown that 20% of dogs show signs as early as 1 year old of osteoarthritis, and 80% of dogs over the age of 8 have the onset of osteoarthritis.
It's a lot of dogs, and it's profound. And I guess what I'd ask our listeners to do is think about yourself and try to make parallels between what you may have experienced in life and what you are feeling at this time, and maybe even some of the things you do for yourself to keep yourself healthy, and extrapolate that to what your pet may be going through.
Right.
Because they can't talk to us. They are oftentimes very stoic. But if you can make those parallels and empathize and listen to your pet, I think you might be more privy than the average pet owner in recognizing the signs and getting early treatment.
I would love people to stop saying it's just osteoarthritis. Oh, it's just degenerative joint disease, because it is a significant factor, just like we talked about in mobility limitations in pets. And I see a very fragile population of animals, as you know, and osteoarthritis can be a contributing factor, in their mobility and their comfort in their last days. Also, I see exotics. So if you have birds, geese, ducks, rabbits, they can have osteoarthritis as well. And if you're a bird and you only have 2 legs and you've got arthritis in both legs, that's a big problem.
Mm-hmm. So we're going to be talking about what is arthritis. Let's demystify it for people. What are its causes? How is arthritis diagnosed? And how can we treat it? Arthritis is, arth is joint, itis is inflammation of. So whenever you have an itis as a suffix on the root word, it's inflammation of that root word. So bursitis is inflammation of the bursa, tendonitis is inflammation of the tendon, arthritis is inflammation of a joint. However, there are different types of arthritis, right? So for today's show, we're going to be focusing on osteoarthritis, OA, or also referred to as degenerative joint disease. So as we alluded to before, it's the wear and tear arthritis.
Just like humans, dogs have joints where 2 bones meet and make the skeleton flexible and allow for movement. Some joints are a ball and socket, some are pivot, and some function like a hinge. But the one thing that they all have in common is cartilage, an elastic tissue that covers and protects the end of bones at the joint. Having cartilage between bones is very important, as it acts as a shock absorber between the bones. And when the cartilage wears away from the joint, the bone underneath is left exposed and susceptible to damage. And as a result, the joint becomes painful. And formations of little bony outgrowths like osteophytes can affect the joints.
So I want to contrast the OA that we're talking about today, the wear and tear, with other types of arthritis. So in people, you may have heard of rheumatoid arthritis, and that is actually a systemic inflammation. So it's a long-term autoimmune disease that causes the body's immune system to attack its own tissues, that is primarily the joints. And for rheumatoid arthritis in people, it's mainly in the hands and feet. There's a similar condition in dogs called polyarthritis, and canine polyarthritis is a condition that causes inflammation in multiple joints of the dog's limbs. And in certain cases, it's immune-mediated polyarthritis, or IMPA. And a veterinarian, in addition to taking x-rays and fully evaluating and so forth, will often tap the joints. And what that means is taking a fine needle and taking some fluid out for evaluation and culture to rule out infection or cancer. And if those things are ruled out, then it can be stated that it's likely to be immune mediated. So similar to rheumatoid arthritis in people, a disease that attacks the dog's own joints. I think it's important to distinguish. And, when your veterinarian may recommend different tests and things, they're trying to get to the root cause, because the root cause will help with the proper treatment. Right?
Exactly. Yeah, exactly. Proper diagnosis is always important for proper treatment and good outcomes.
So we've talked about that, it's characterized, the OA is characterized by a breakdown of cartilage in the joints. And over time, this leads to pain, inflammation, and mobility dysfunction of those affected joints, as you said, Cathy. Let's remind people of the signs of inflammation, because then this makes sense to a lot of people, again, trying to demystify. So inflammation has 5 signs. Pain, first and foremost, meaning that's why we take our dogs to the vet, right? We never want to see our pets in discomfort. Pain is one of those 5 signs. Then there's swelling, redness, heat. Now, again, that may not be that obvious on the outside, but if you ever saw an arthroscope with a camera taking a picture of an angry arthritic joint, all that's going on. There's swelling of the synovial tissues. It's angry and red. And there's extra heat. The temperature in that joint is hotter than the surrounding areas. And sometimes if you take the back of your hand, you can feel that heat in your dog's body, which is a sign of inflammation. So I just had a client recently that said that every morning her dog has heat over the mid part of his back. And I'm like, yep, probably has some arthritis there.
Right.
And the final sign is loss of function. So what does that mean? That's when you see stuff like limping. My dog can no longer jump onto the sofa. My dog doesn't want to come upstairs. Those are functional activities that they have done their whole life. And when you start to see hesitation, they're losing that function, the ability to do that. Why? Because they have arthritic joints in a lot of cases.
Right. And some of the lesser, maybe, I mean, those are all the signs certainly of inflammation, but you can also notice, when your dog gets up in the morning, are they stiff? I go, we probably have some osteoarthritis. So stiffness can also be an indication of inflammation and or pain or joint dysfunction.
Yeah. And oftentimes that stiffness is in the morning or after a nap. So the pet has had a period of rest. And you probably experienced this yourself. Remember early in the show, I said, think about yourself. I have back pain and knee stiffness every morning that I get up. And then I move around and I get the blood flowing and I get that joint lubricant going and I feel better. And Cathy, even though osteoarthritis or degenerative joint disease is a function of wear and tear, it is important to remember that it can happen at any age to any joint. So what are the things that cause osteoarthritis? Let's get into some more details. Yes.
It's a variety of factors, which can
absolutely
include genetics and age. Obesity is a big one. Joint injuries, as we discussed earlier, and certain diseases like elbow and hip dysplasia can be a contributing factor to osteoarthritis. As we said before, just that repeated stress on the joints, from activities like running and jumping and, stuff like that. Regular dog life.
And especially if you ask a pet to do something. So again, I think about, people that get a dog to run with them. Mm-hmm. There's a certain age that you should wait to start, but just like you as the runner, you may be prone to overuse injuries, Achilles tendonitis, iliotibial band syndrome, etc. The dog can experience the same thing. And maybe you don't run as often or as far, or you seek out softer surfaces when you run. That's all going to help your pet too. So those overuse things can happen with any activity, agility, fly ball, we're herding dogs,
right?
They just tend to do a lot of things. Yeah, they're very active and that's a good thing, but over and over again. And then you also should think about any congenital deformities, because we will often work with those pets and we worked hard on Petability to normalize those that are differently able. But if their body is different, then it can cause, and they move differently, then it can cause certain stresses and, maybe premature wear and tear on certain joints.
Depending on how they've compensated, they're using their front end more and adapted. So, and then let's not forget our cats, because I think that our cats are underdiagnosed with osteoarthritis. And when I hear from clients that their cat who was once, jumped on the counter, jumped on the chair, and now is not jumping. I think about cats, similar in dogs. These cats over the age of 8, whether I know they have osteoarthritis or I don't, I treat them as if they do, because they're getting up to, 9, 10 years old. They may very well have osteoarthritic changes. And you know how cats are, they just hide it. They hide it so well. But there are certain things they can't hide, like they're jumping. They used to jump and they used to run and they used to, how cats are, they could jump straight up off the ground into the air. And that's one of the first signs I noticed in cats. Their jumping ability is sort of limited. And so don't forget, our cats as well.
And a dog may try and miss. A cat may just kind of subversively stop going to those higher places and you may not even notice, they choose a lower perch or, they're sleeping more in their bed that's, on the ground or what have you. So paying attention to those signs is definitely important. Right. Let's talk about some of the other signs that we haven't covered yet. I think we've gotten most of them, right? So you mentioned stiffness. We talked about limping. Oh, difficulty getting up and down from the ground.
That's a big one.
Yeah. How
That's a
long
big
does
one.
it take? How much effort do they have to, to
Yeah.
get up? Do they circle a lot and kind of pace in order to lie down, before they lie down?
Yeah. And the big groan. Ugh.
Yeah. Yeah. We talked about stairs. You just mentioned jumping with cats. I think anytime our pet is showing any sign of pain, we need to think about arthritis. And we had a show on pain and inflammation earlier as well. And we talked about maybe choosing to rest and not engaging with the typical family activities, going to put themselves away, if you will, and kind of hide so that they're not asked to, move around as much or what have you.
And they might be grumpy, maybe they weren't grumpy, but now they're sort of grumpy. And it makes sense.
Literally listening to your pet.
I have a bird that I treat who's got osteoarthritis in both feet. And one of the ways I know how he's feeling better is based on how he tries to attack and kill me. And sometimes you can see that he's limping and struggling to walk. And sometimes he's feeling so good that he just comes right at me, and for me, that's a measure of how well is he doing, how well is he doing with his murderous rage. And symptoms in osteoarthritis, they can fluctuate in severity. Osteoarthritis is chronic in nature, and it's a long-term degenerative joint disease that worsens over time because of the breakdown of cartilage, and symptoms can fluctuate. So such as pain and stiffness, maybe even reduced mobility can vary. And there are certain things that can be factors. Like I notice that my osteoarthritis patients are more uncomfortable, like changes in barometric pressure. I think barometric pressures are a factor.
Mm-hmm.
And so they can have acute flare-ups, but they can also have periods where they're sort of stable and okay. Because I live with osteoarthritis. I get up in the morning and it hurts and I move and it feels better. But there are times when I have acute flare-ups of osteoarthritis and then I get off the Tylenol because I'm so uncomfortable. So they can fluctuate.
Yeah. And even seasonally, so they can fluctuate with the weather in any given season. But, I think a lot of times, dogs will do better in, maybe the warmer months because that cold can contribute to more stiffness and lack of activity and so forth. A lot of people move to warmer climates in the winter to control some of their aches and pains, so that kind of makes sense. And why even applying a gentle warm pack, to a stiff arthritic joint can be helpful on many levels.
And it becomes such a vicious cycle of pain and immobility. So the pain and immobility leads to more immobility, and then immobility leads to weakness. So it becomes a vicious cycle of...
And the weakness then doesn't allow for the support and stabilization of the joint. So it changes on a micro or even macro level, the joint play, if you will. So again, things can become less congruous, and then there's more wear and tear because it's not in an ideal position.
This is why I'm so pissed off at osteoarthritis. And this is why I think we shouldn't just say, oh, the pet just has osteoarthritis. There's so many things that are affected by osteoarthritis of the joint. So many daily functions, their daily living, their quality of life.
And I think people need to understand it's a disease. Arthritis is a disease. It's not just a little inconvenience. And, it's definitely in the top 10 for which people bring their pets to the veterinarian because, it causes problems. So Cathy, let's touch on a few things that we haven't mentioned that can actually predispose dogs or pets to arthritis. And, if your dog is limping and stiff and painful and seems to have inflammation, it can certainly be other things. But, you've checked their paw, there's nothing in it. They didn't get an insect bite or a sting. There was no known trauma. They don't have a broken bone. So it could be Lyme disease or infection. If those other things have been ruled out, then you're by default left with degenerative joint disease. Does that make sense?
Tick-borne diseases are rampant in this part of the country. I imagine it's probably everywhere, but they are rampant. They are a huge contributing factor to osteoarthritis and long-term, pain for these patients.
Right. So take your pet to the vet if, again, this limping or pain lasts more than 24, 48 hours because you need to make sure it's none of these other things, which could be very grave. So when you take, let's say, your dog to the vet, what happens? How are they diagnosing arthritis in our dogs, Cathy?
Well, I mean, certainly the physical exam is going to help the veterinarian with their assessment and their evaluation and their diagnosis. We can also do imaging. I worked a long time in radiology at Angel Animal Medical Center, and I've seen thousands of x-rays. It's one of the ways to sort of determine whether we see osteoarthritis in a joint, but it's not necessarily, or the x-rays don't necessarily correlate with pain level in dogs. So sometimes I see x-rays that appear to be sort of minimal osteoarthritis and the patient is very painful. And sometimes I see significant OA in joints and I go, how is that dog moving around? That is a significant amount of OA. I don't know that it's your defining factor, but I think it definitely helps put the picture together.
Yes. And that's also true with x-rays and people. Yeah. Same sort of phenomenon where there's not necessarily a correlation, but like you said, it's one more test that helps to maybe rule in or certainly rule out some things. It's a relatively inexpensive test, and getting some baseline imagery is always good, I think, if something is suspected.
Its limitation really is that it's not great for visualizing soft tissue. So it's not great for structures like cartilage and ligaments and joint capsules and so forth. But it is going to, it can lead us down the road with bony changes, lead us down the road to osteoarthritis. And sometimes we don't really know what that cartilage looks like unless we get like an arthroscope and look in there and then go, wow, there's a significant amount of damage in there. So it's just another tool in your tool bag for diagnosing osteoarthritis.
And you mentioned the clinical picture. And I always think that exam, along with you, the pet owner's subjective description and report. Because if you're describing some of the things that we've mentioned already, and that seems to correlate with the findings in the exam, then we're pretty safe at assuming, this is probably due to arthritis, just based on its prevalence. We interviewed Aaron Scott, who has the dog journal and or the pet journal. And, this would be a great use of that, and noting changes and some of the things that you're seeing over time and if treatments are helping and so on, because it is a multimodal treatment. And we're going to get to that a little bit later. But let's say, Cathy, you take your dog to the general vet and they're like, yep, I think it has arthritis. Then they're sent to us as physical rehabilitationists or physical therapists. What do we do? How do we go one step further?
Well, the first thing I'm going to probably do is, I'm going to get down on the floor and kiss your dog and give you a cookie. Give the dog cookies, of course, right?
You cheat.
But I know that's how I make friends. I'm going to do several things. I'm going to do a gait analysis. I'm going to watch your dog walk. I'm going to do range of motion measurements of the joint to see if they're within normal limits or if they're outside of the normal limits. I'm probably also going to do some muscle girth measurements too, to see if there's atrophy of one muscle group versus another, or if the left hind leg versus the right hind leg. And then I'm going to watch your dog do some physical tasks like sitting, lying down, trying to stand up again. So those are some of the things that I would do. Did I miss anything, Chris?
No, I just want to tell people that I try my best to start observing your pet as soon as they come into my presence or I come into their presence, right? Because our eyes can tell us so much. And then the next thing is my hands, the palpation. So we talked before about assessing warmth. You can sometimes feel atrophy if it's that profound without having to get out a tape measure. The qualitative as well as the quantitative measurement of a joint. Are they guarded? Are they not letting you bend that joint? We know with every single joint that there are restrictions typically in one direction versus the other. So for example, if we suspect that they have a front limb lameness, well, where is that coming from? Is it their feet? Is it their wrist? Is it their elbow? Is it their shoulder? So if they're not letting me touch their wrist and I can't bend their wrist, I'm like, yep, probably that wrist joint or carpus. And then also, as you said, I think those functional tasks are very important because, who cares really in the whole scope of things if, a dog has 10 degrees less knee bend, on one side versus the other, but can they sit down on their own and get up again? And that's the quality of a life stuff that we are trying to restore. So we have to note all of those functional limitations as well.
And if I have access to it, for me, digital thermal imaging is always helpful because I could see the temperature differences. Some places have access to it. Some places don't. But if you have access to it, it's actually a pretty good tool for assessing temperatures, in certain areas of the body.
Right. So indicating by this picture that's taken, and there's different colors that that light up on the screen, and like red color indicates there's more heat in an area, whereas green or blue says that it's colder in an area.
Right.
My dogs have both had that done, and I always forget about it. They've had it done a couple of times, but I've never used it myself. So I'm glad you brought that up. Now we know, right? That we've seen these signs. We've taken our dog for an examination. What are the treatment options?
Well, rehabilitation, of course. As a rehabilitator, I would say that is probably your number one option. Refer dogs to rehabilitation for their osteoarthritis.
Doing it early.
Right. You don't want to be behind the 8 ball. I don't want you to, I want to get you as soon as I can. Yeah.
Right. And so it doesn't mean that if you come in for, physical therapy, oftentimes I will just see a pet a few times and give you a lot of information, you, the pet owner, education about different things you should and shouldn't do, specific exercises to help, to stretch or loosen an area of the body, to do targeted strengthening, always working on the core, lifestyle changes with traction. Oh, let's get those nails trimmed. Let's raise that water bowl. How about swimming instead of running with your dog? It's a low impact exercise it's a no impact when you're swimming. Underwater treadmill hydrotherapy for decades been considered the gold standard in terms of physical therapy. And that's because it can reduce up to about 85% of the pet's weight, the dog's weight on its weight-bearing joints. Because again, the wear and tear tends to be on the weight-bearing joints, just like hips and knees for us.
I think the other thing we need to include in that as rehabbers is getting a body mass index score for these pets that come in with osteoarthritis, because weight management is going to be a significant factor in pain reduction for your pets. So if they are overweight, you would be surprised how much better they are going to feel when they get the extra weight off. So we want to get those BMI scores, and we want to get those weights down in pets that are overweight.
Oh, such a huge impact.
Right. Such a huge impact. You'd be surprised. I have patients who have lost 10 pounds and came off of their non-steroidal anti-inflammatory drugs because they've got that 10 pounds off. And they just feel so much better. And then, of course, I just mentioned it, pain management, which would be up to your veterinarian. Your veterinarian would be the person that would lead your pain management program for your pet. We see dogs that come in on medications that are non-steroidal anti-inflammatory drugs, your Rimadyl, your Duramax, your Previcox. And we also see dogs that are on drugs like Galliprant, and you also see dogs that are on drugs like gabapentin or amantadine. So those are prescribed by your veterinarian. Always follow that pain management regimen. We want to have the dog appropriately managed on their pain. So sometimes I have patients who start taking their dogs, their dog will start taking their Duramax, and then 2 days later, they're like, oh, the dog is better, I'm going to stop this Duramax. But really, we need to have a certain period of time on those non-steroidal anti-inflammatories to really get that pain down, that pain wind up back down to a normal level.
And also the right dosage, because that's based on body weight. And I think sometimes people don't realize, like, some are 12 hours, some are 24 hours. And that's how long it stays in the body in their system. It's called the half-life, but that is also based on the dog's body weight. So, of course, we always want to give them the minimum amount of drugs that is needed to have the positive effect. But, if you're choosing to not give it at the frequency prescribed or the dosage prescribed, then you can kind of have this roller coaster effect of that medication.
And then, of course, joint supplements. I mean, we're all about, the supplements, glucosamine, chondroitin, fish oil, things like that. We're all about, adding those. And fish oil is a great anti-inflammatory. Glucosamine is great for the joints. Yeah.
Yeah. And MSM and the fish oil, the omega-3s, I think are especially important. They've done different ratios and different subsets of the fatty acids that are appropriate. And what's appropriate for a person is not necessarily the same for our pets.
I think that we also have to remember that we need to give our pets supplements that are made for pets and not for people. A lot of this is about bioavailability of the joint supplement.
How it's taken in, right?
Like, how it's taken in, exactly.
Be absorbed,
and I know that, maybe you're like, well, I found one cheaper on Amazon and it's a human, but you really want to stick with those joint supplements that are made for the canine patient or made for the feline patient.
And not just that, but because joint supplements aren't FDA regulated for people or pets, you want to go with a reputable company that's been around a while and has proven their efficacy over, millions of pets over time. They have their own checks and balances and assure that what they say is in it is actually in it. There's so much competition out there now between supplement companies. And I highly recommend that you listen to your veterinarian on that, because they probably have the best idea. I take my dogs to a holistic veterinarian and doing things like acupuncture and Chinese Eastern medicine, kinds of supplements and things too.
Some of my patients see the chiropractor as well. It's important, though, to mention that these people are seeing chiropractors that are trained in chiropractic medicine or veterinarians who are trained in chiropractic medicine. Right.
I also want to mention, Cathy, that there are some injectables that have been around for a long time that can be injected directly into bodies and or joints, depending on what's going on. So I know Adaquan, which is a, ready for it, people, polysulfated glycosaminoglycan.
Just tell people it's like an injectable glucosamine,
Yeah, exactly. And there was a lot of talk about this. I know when we took our certification and things. The important point is that Adaquan has been proven to slow the progression of DJD.
Right.
And then another one is hyaluronic acid, or HA. Beyond the lubricating properties of HA, it also plays a role in controlling that inflammation. It does so by regulating the body's inflammatory response and aiding in the repair of damaged tissues. So those are some injectables that you may want to ask your vet about. I want to mention another faction of treatment for arthritis, and that is in the area of what's called regenerative medicine. And I guess I think of three things there. One is called PRP, or platelet-rich plasma injections, where they actually remove the patient's own blood cells and put them through a centrifuge, inject them back into the body, and this can accelerate healing of multiple conditions, but they're using it a lot for OA. Then the next step beyond that is stem cell therapy in regenerative medicine. So a little bit pricier, a little bit less accessible, but that may be something you'd want to consider for more severe cases. And then finally, there's this new treatment using amniotic membrane, and it's showing great promise in treating osteoarthritis. Still more to come. With any of these three, you're going to get maybe some longer term results for more severe conditions. There's a new medication out called Librela by a company called Zoetis that is also an injectable that is done under the skin subcutaneously once monthly. And it is only for addressing osteoarthritis. It's OA specific. And what it does on a chemical level is it blocks pain. So again, it's not curative. We know that OA can't be cured. And it's also not designed to be a standalone drug. So I hope you've heard us emphasize that there are many, many options for treatment, multimodal.
Yeah. And for us, we would recommend physical rehabilitation. We have access to things like laser. We have access to the MedcoVet Luma, the red light therapy, home therapy treatment. We're putting healing in the hands of the owner. They can use this red light therapy in between appointments. We could do custom-made therapy programs, passive range of motion, massage, joint mobilizations, joint compressions. There are just so many things that we can do to improve the quality of life for your pet, mitigating the damage that can be caused by osteoarthritis in your pet. No matter what stage of osteoarthritis your pet has, physical rehabilitation is my recommendation.
How are we mitigating those changes? Oftentimes it's we're focused on the inflammation. And we had a whole show on inflammation, and there's a place for inflammation and healing. It's required acutely, but when it goes into a chronic inflammation, then it becomes what, Cathy?
Then it becomes your enemy, your frenemy, because there is a place for inflammation, but there is no place for chronic inflammation.
Yes. Yeah. We don't want inflammation to stay too long.
Yeah. It's like a bad house guest.
And I can't remember, Cathy, did we already talk about CBD? A lot of people
No, we didn't mention
using,
it.
a lot of people are finding CBD to be effective. Again, that is the cannabinoids, not THC, does not get your animal high. So the different chemical elements of the marijuana plant that can be very, very effective in pain control and so forth.
Chris, how about we talk a little bit about exercise for pets with osteoarthritis?
Well, the biggest key, Cathy, is that it be low impact. So we already mentioned that swimming is no impact. Underwater treadmill would be between swimming and walking. I'm assuming most of our listeners don't have access to an underwater treadmill, except perhaps at their physical rehabilitationist. But if you can't do hydrotherapy, then slow and steady walking, leash walking, is perfect because that's the most accessible, low impact exercise that you have available to you. Right. So, I think that dogs at any age can move about their environment and do, shorter but more frequent walks. They may just be a few minutes up on their feet, again, following you around the yard and so forth. But, you think about those dogs that maybe have been running with their owners since they were 2 years old and now they're 10, you need to slow it down. And their dogs have 6 types of gait. And at a walk, it's called a 3-point gait. And what that means is at any given time while they're walking, 3 feet are on the ground. So the load, the weight of their body, is shared amongst 3 limbs. If you go to the next most common gait, trotting, that's a 2-beat gait. So what that means is that at any given time during the trot, 2 feet are on the ground and 2 feet are suspended. So now the whole body weight plus gravity is only shared amongst 2 feet instead of 3. So that could mean that there's more impact on those joints that are hitting the ground, right? So the general rule of thumb is to keep things at a slower pace. Obviously, if the arthritis isn't as advanced and your dog chooses to, trot or canter, that's fine, but maybe not asking them to do so. And if the arthritis is more advanced, a slow, steady walk is perfect. And Cathy, I think about myself, right? Like not that long ago, I guess it's been a while now, but I was still playing volleyball and I love flag football and softball. So these team sports required a lot of running, jumping, fast starts and stops. Well, now at almost 60, I'm doing things that, are less impactful. Pickleball, I'm addicted to pickleball like so many of you out there, but that's certainly less challenging on our bodies than tennis. So that's why it's accepted by so many people. They say anybody of any age can play it. And I'm doing a lot more walking, walking the dog, cycling. I even got an e-bike to make it a little bit easier on my joints, but still keep me active and, doing things like yoga and Pilates. So changes for our lifestyle. Let's think about those for our dogs as well.
Yeah, I've always been a low impact kind of girl throughout my whole life. But you know what? It's still movement. I probably shows too that I've been a low impact girl, but yeah, as I get older,
Cathy, you look very fit.
Thank you. The lower impact exercises for me at this stage of my life have been much more friendly than the jumping and the running of like I used to do when I was in my 20s and 30s.
Don't discount the power that you have as pet owners to help your pets to thrive through arthritis. They're not just getting old. Listen to them, watch them, see the changes, and address it. Address it early on. Get to the veterinarian as soon as you start to notice these signs of arthritis. Especially if you own a larger giant breed dog, because they have more weight on their joints. So again, they're more predisposed to arthritic changes than maybe some of the smaller breed dogs. But can't emphasize enough that arthritis can take place in any joint, at any age, in any breed
and species. And how about we talk a little bit about, surgery? Are there surgeries to help these patients with severe osteoarthritis?
That's a good question. There certainly are. I mean, there are arthroscopic surgeries, which are a little less invasive, and there are open arthrotomies. I feel that the surgeries are more at the early stages to prevent arthritis, or at the latter stages as what may be considered a salvage procedure. So early on, we mentioned elbow dysplasia. Because of incongruous bone growth at the elbow where three bones come together, oftentimes a little piece of bone will break off and it becomes like a pebble in your shoe. So every time that dog is moving that joint and bearing weight, it's like standing on a rock in your shoe. And it's uncomfortable. And that little pebble, which is often referred to as a joint mouse, can kind of float around within the joint and erode and eat away at the cartilage. So if your pet has surgery to remove that offending piece of bone or cartilage, get rid of it, you're preventing all of that potential inflammation and joint damage over time. So that's great. We also mentioned cruciate surgery. So if there's significant instability at the knee joint, a surgery can be done to stabilize that joint and again, prevent some of that excessive movement, that friction and that wear and tear. Then you can prevent such severe arthritis down the road. Now, at the other end, the salvage procedures, we can think about what's called an FHO or femoral head and neck osteotomy. If there's severe hip arthritis, maybe due to trauma, it could be a fracture, a hit by car when they were younger, or severe hip dysplasia, sometimes that arthritis, that subsequent arthritis can be so debilitating that they will go in and actually cut off the end of the femur at the hip joint and remove the ball and socket. So now those two bones aren't grinding on each other, bone on bone anymore. And dogs have a miraculous ability, and cats also for that matter, to form what's called a false joint. So through scar tissue and strengthening, they can support their body without having that ball and socket present anymore. And then there are other things like arthritis. I think that often happens at the wrist joint, right, Cathy? Like a hyperextension injury.
Typically, I'll see arthritis usually in the carpus, and it's because these pets have carpal hyperextension, which is really painful, but it's also very limiting. As a rehabber, I hate the thought of fusing a joint, but in some cases, we need to do that for the stability of the joint. Right. So whether your dog or pet is a candidate for any of these types of surgeries, of course, will be determined by your veterinarian. And there can be many factors such as age and the type of disease that your pet has, or the type of injury or trauma or congenital, malformation. And they're also considering and also taking into consideration any comorbidities. So some of these dogs are going to be good candidates for surgical repair, surgical salvage procedures, and some of them may not.
And they're even doing total joint replacements these days in pets. So I've treated, and I'm sure you have too, a few dogs with total hip replacements. And then I had one dog with a total elbow replacement, which was pretty new at the time. One doctor in Boston was doing that. And this dog was a chocolate lab, had a lot of success following that elbow, but at least in the short term.
Let's close up the show, Chris, with talking a little bit about what lifestyle changes we can do to help our pets with osteoarthritis.
Sure. Well, you already mentioned like healthy weight. So that goes back to proper diet and things like that. So that's a huge lifestyle thing, but even little things we can do in the home, right? So sometimes I forget, how old is my dog's bed? And we did a whole show on beds. And so getting a supportive bed that is right for your pet is really important. Using things like ramps instead of stairs, or little stairs to get to a height instead of jumping can be very helpful in decreasing impact and promoting safety. Traction.
We say at almost every show, traction is so important and something you could make so easily happen in your home with rug runners and yoga mats and foam tiles. But my favorite product, of course, is Dr. Busby's toe grips. Easy to apply and tolerated very well by patients, and really helps them get a grip, if you will, on hardwood floors or slippery surfaces. Because dogs that have osteoarthritis in their feet may not have the ability to activate that natural mechanism in their feet that they do when they try to grip to stop sliding. And these little rubber toe grips, little rubber cylinder toe grips, are going to help them by providing a little grip zone behind the toenail. So it's one of my favorite products.
Well, I was going to say early on in our podcast, because we've been on now for 4.5 years, but we felt so passionate about some of these things that we have entire shows on beds, the importance of traction. We actually interviewed Dr. Julie Busby about the toe grips and many topics, low impact exercises, hydrotherapy, the list goes on and on. So if you want to delve more deeply into that, please check out the other shows.
Use your help them up harnesses, use your gingerlies, your slings, if you need to assist your dog in any way on the stairs or getting in and out of the home or getting in and out of the car. So I love all those ideas. So.
And you know where you can find all of these products, Cathy?
I do know where you can find them. You can find them on vitalvet.org. You are not going to find anybody with more experience than vitalvet.org and Ilaria Borghese. She's been with all the rehabbers since the very beginning of the inception of canine rehabilitation. So check out vitalvet.org. You could do all your one-stop shopping there.
Right. So our podcasts are there related to rehabilitation. They have a plethora of vetted products and a lot of educational materials written, like I said, our podcast and tutorials and so on. So it's definitely a place to go for both pet parents and veterinary professionals.
All right, Chris, I think we covered as much as we could about OA. We could probably go on for 2 or 3 more shows on osteoarthritis, but I think we laid down the basics today. So,
yeah, absolutely. And things go according to plan. Again, continue to tune into Petability because we're hoping to delve a little bit deeper into some of the subsets and various topics that we've touched on today. Just so much to cover. So I hope you learned something.
All right, thanks. Bye.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you and tune in next time.